Hello and welcome to my presentation on Protein C, your anticoagulant ally. I hope you find this presentation informative. I will be discussing the pharmacokinetics, mechanism of action, and physiological impacts of Protein C, along with its legal, clinical, and ethical considerations. Protein C was first discovered in the mid 1970s by Dr. Charles T. Esmond and Dr. D.J. Amphil. They isolated this protein and revealed its role in preventing clot formation. This discovery paved the way for more research into blood coagulation mechanisms and the possible therapeutic uses of Protein C. Protein C is essential for managing blood clotting and preventing harmful clots, protecting against conditions such as deep vein thrombosis. It holds significant clinical value, especially in forms like activated or recombinant protein C, being crucial in treatments for severe clotting disorders, highlighting its essential role in medicine. Pharmacokinetics. Protein C is a natural protein in our body. It does not have pharmacokinetic parameters discussed in the same way that administered drugs do. However, when it is activated, it becomes activated protein C, and when given as a treatment, we would consider how it's absorbed, distributed, metabolized, and excreted. Activated protein C is a glycoprotein that is primarily synthesized in the liver as an inactive precursor known as protein C. It circulates in the bloodstream and is activated at sites of vascular injury. It undergoes hepatic metabolism and is primarily eliminated through the kidney. It can be administered intravenously or subcutaneously. Activated protein C has a relatively short half-life in circulation, estimated to be around 4 to 6 hours and rapidly cleared from the bloodstream through proteolysis. The distribution of activated protein C is primarily in the intravascular space where it exerts its anticoagulant effects by inactivating coagulation factors 5 and 8. The anticoagulant actions of activated protein C come from its complex interactions with several parts of the blood clotting process. Here are the main steps in how it works. Activated protein C is generated by the enzymatic cleavage of protein C by thrombin when thrombin binds to cofactor thrombomodulin on surface of the endothelial cells. This conversion of protein C to activated protein C is crucial steps in its pharmacodynamics. It functions as a serine protease that selectively cleaves and inactivated coagulation factors 5 and 8. By doing so, it hinders the amplification of thrombin generation, which is essential for blood clot formation. It also exerts indirect anticoagulant effects by modulating other components of the coagulation cascade. It downregulates the activation of factors 9 and 11, further limiting the generation of thrombin. Besides preventing clot formation, activated protein C also has anti-inflammatory and cell-protecting effects. It blocks the release of molecules that cause inflammations and helps keep blood vessels intact. The adverse effects related to protein C primarily revolve around alterations in its level or activity, leading to either an increased risk of bleeding or thrombosis, depending on whether there is an excess or a deficiency. Additionally, the therapeutic use of protein C and its derivatives carries inherent risk and requires careful considerations of the benefit-risk profile. The adverse effect could be increased bleeding, thrombosis due to deficiency, complications in severe deficiency, risk in liver disease, and adverse reaction to therapeutic form. Legal and ethical considerations. Protein C occurs naturally and is crucial for regulating blood clotting in the body, so it usually doesn't have the same regulatory scheduling as synthetic drugs, unless formulated for therapeutic use. However, a therapeutic form, drotrecogin alpha, has been withdrawn from the market and currently has no SUSMP schedule. Only licensed healthcare providers like physicians or nurse practitioners can prescribe such treatments. An interdisciplinary team approach involving hematologists, internists, pharmacologists, and other specialists may be needed for optimal management of conditions related to protein C. Therapeutic considerations. Potency has been used in clinical settings to treat conditions like severe sepsis and disseminated intravascular coagulation. For dosing and administration, clinicians must consider the appropriate dosing regimen and route of administration, taking into account patient-specific factors such as age, weight, and medical history. Monitoring and safety. Close monitoring of patients receiving activated potency is essential. Attention to safety measures, including risk of bleeding, is crucial. Take a few moments to evaluate your knowledge on potency.